me turn this over just a second. Okay. This picture.
Welcome everyone to the April Learning Forum. Please enter your name and agency in the chat and we're gonna go ahead and get started. I'll continue to admit people in and turn it over to Tara.
I just get a sense that Tiffany's clicking, click, click, click. There's always the rapid fire, so I'll give it just a few seconds. All right, Tiffany, you think we're good for now? Okay. Hey, thanks for your help. Hi, everybody. Happy April. As usual for our monthly forums, we have lots of great content today. And as a preface to our general meeting coming up next month, it's time to turn this over to the folks doing all the heavy lift, specifically our 4 trimester champions. So today, we're going to advance. There we go. Our quick agenda for our noon hour is just to go through general meeting, exciting to share with you registration information specific to that event coming up next month. I'll do a quick 4th trimester update for everybody. And then we've got some great guest speakers to update us on what's happening in Kansas. As is always exciting, we got to welcome yet another hospital facility to our 4th trimester initiative, Olathe Medical Center. I have to tell you, this felt really good. You all should know that when I get those emails in, I feel like I'm having a party all by myself over here. But it's a wonderful thing to see an organization like Olathe, known for its hard work and great outcomes for women's health, agree to join and to get enrolled. It's not too late. If you have colleagues at other facilities, or if you're a facility that's not enrolled, there is no such thing as a deadline for entering. It's just the catch-up period that feels a little awkward. I can make that as easy as possible. But we're thrilled to have Missy, the birthplace educator, and her team signed on with 4th trimester. So welcome to you guys. Other big news in the state, for those of you that may have heard or heard rumor of this, it's true. It's why I have that image there. It felt like I was, again, partying in my own office the other day when we heard that the governor, in fact, signed a large bill that extended Medicaid coverage to 12 months postpartum. If you all remember when we first started this conversation nearly a year and a half ago, this was our top priority, one of our top priorities. And I believe that COVID and other opportunities, but especially the current federal administration, who have really pushed this conversation to go faster than I would have ever guessed. And yet here we are. So good for Kansas, good for all of our moms and babies and families, but Medicaid coverage up to 12 months now. So huge, huge win for them. And then for those of us that respond to and are funded by and have CMS in our world, specific, or as we talk about Medicaid, sure enough, as part of the Black Maternal Health Month and specific work and push out of initiatives regarding that in the last week or so, CMS announced that hospitals that are involved in maternal QI initiatives like KPQC's work, 4th trimester initiative being the specific work right now, that in fact, designation of that facility will appear on CMS websites, it shows the forward commitment of that hospital to improved outcomes, marketing, strategic planning, and again, kind of a gold star to those facilities that are enrolled in initiatives like ours will be CMS's push further. This is big to your hospitals. So if they aren't aware of that, send that link to them. Let the QI person and your CEO know that you all are engaged and enrolled. I will tell you that I thought everybody at our facility knew. And when I sent this information out, the person who responds to CMS QI dug deep and had no idea that our hospital was enrolled. So I push for those who aren't enrolled. This is a great reason to become enrolled, but also for those of you that are, to let your QI folks who send reports to CMS know that you're doing such great work. And the general meeting. So I'm hoping that everybody on this call got an email either from the KPQC email listserv, if you're a fourth trimester champion or fourth trimester enrolled site, that you got it directly from me. But there's a big day planned, May 24th, 2022. We are going to have a hybrid general meeting. The majority of you all who are KPQC membership, so that if you're not a fourth trimester champion, that would be all of their staff, providers, agencies, anybody who's not a fourth trimester champion is encouraged and excitedly welcome to join us for the morning session on May 24th. The general meeting will consist of 9 o'clock to noon, 3 guest speakers. They are phenomenal. Their bios are listed underneath the agenda there, and we are focused on respectful and equitable care for this general meeting. Powerhouse speakers, great thought-provoking action plans, and where Kansas is going to go next under the leadership of Dr. Charlotte Smith with our work amongst our fourth trimester sites. Then for those of you who are fourth trimester champions, you will be in Topeka on site with us. And I'm so excited to see your faces in person and to get to meet you all and to work collaboratively with you. So after the virtual portion of our morning, those of you that are fourth trimester champions will stay, have lunch with us, and then we're going to work in team settings to get everybody caught up, to work on next steps within fourth trimester within your facility, to help each other through the next step processes, and to come up with some great brainstorming plans in Kansas. So number one, make sure you got your registration in an email. If you didn't, reach out to Tiffany or I, and we will send that to you ASAP. And then for the fourth trimester champions, I just want to make sure it's clear, you're the all-dayers. One person from each facility is required to be there, but I hope that it's more about that you're excited to be there. And that's a separate registration. You should have gotten that from me. I'll facilitate questions at the end if you have any regarding that, you guys. And this is just a repeat of what I just described, that there's just those 2 different registrations that probably could have come to you. Real quick, I want to go through some state statistics because I think it's helpful to know who we're caring for. And when we get updated information, we need to pay attention to it. If we're going the right direction and the data tells us that, great. If we have to stop and figure out a left turn, that's why the information is helpful. Now, this is 2020 data that was released recently. Keep in mind, we're lagging a little bit due to COVID and the Office of Vital Statistics trying to get caught up to all the reports that have to be done each year. But this is 2020 data that came out. Look at the number of live births. Look at the number of stillbirths for total births in Kansas in 2020 at 34,537. Number of abortions is there because I qualify and quantify those in our fourth trimester project. And then 5 maternal deaths compared to 7 in 2019. Again, you'll get this slide deck to kind of dissect that further in your head after our meeting today. What does that mean for the fourth trimester if we talk about how much of an impact is our work making? Well, if Kansas births in 2020 was 34,537, fourth trimester births were just over 27,000, nearly 28,000. We are now affecting, with your work, over 80% of Kansas births. I'm proud of you all. This is a huge number, and I would challenge to tell you that I suspect we'll be above 85% in the next month. That means that we're not at 100, and I want to be, but we're getting closer to nearly all births being impacted by the work that you all are doing to improve mom and baby health. Good job. This is the picture of that. A little hard to read sometimes on the screen, but look where we're scattered. You see a dense population of enrollees on the east side, so to speak, of our state. That's also where the predominance of births occur, if we're talking about dense populations. But look how far-reaching this project goes. And congratulations to all of you for being part of that work. Also something to have on your radar as we talk and listen to our fourth trimester champions later, and we hear from our breastfeeding expert today. I think it's important that you all understand who we care for in terms of what they bring to us, right? We can help and refer and screen and treat, but what do we see happening and what do we have coming towards us? This was an eye-opening part of that 2020 data that was released from KPQC that told us, based on birth certificate data, 57% of births, there was a report of a medical risk factor in those births. It could have been, as you can see the list on the left-hand side there, gestational or pre-pregnancy diabetes, preeclampsia, eclampsia, infections contracted or treated during pregnancy, vaginal bleeding, alcohol use. But 50% of births in 2020, the maternal risk factor, a maternal risk factor, at least one, existed. That's over half. So if you sometimes feel like the acuity of the patients has increased because of those risk factors, you are correct. This just dives deeper. Again, I'll send this slide deck to you and you can take a look at it. Specific to race, pay attention to what the numbers there on the right-hand side. White non-Hispanic, Hispanic numbers, and Black non-Hispanic numbers there. But also, again, look at the number of stillbirths and how that was an inequality. I'm just going to say the word inequality. 10 per 1,000 live births of Black non-Hispanic women versus 3.4 per 1,000 for white non-Hispanic. That you should pay attention to that. That means something. And so it'll be part again of our continued work forward. Also, for those of us that work at the birth settings, you might have noticed a slight decrease in births, 2.9% in the state compared to 2019. Of note, 2020 birth rate was the lowest Kansas birth rate on record since they started keeping data back in 1912. The birth rate has been steadily declining since 2008. That is the case. I saw some of your hospitals had higher birth numbers this last year versus last year, but overall, this is Kansas's birth rate data. And then you can see the ages of the women that we're caring for, predominance in the 20 to 29-year-old category. Actually 40% in the 30 to 39 category is eye-opening. We knew that, but it's helpful to see that. And then those 40-year-olds and above, 800 in our state delivered babies, and I'm certainly as proud of them as I am of the 20-year-olds. Vaginal and C-section rates are also there listed for you. Again, probably not an aha moment. Many of you already knew this and have reached out to me for deep dive with our maternal mental health experts, because you're seeing this in your facilities and in your clinics, certainly in your agencies, that the postpartum depression rates have not only doubled, but tripled for new moms during the pandemic. And the ability to get a mom in after she's been screened and referred forward for care has been catastrophically difficult. All the work that you're doing with Kansas-connected communities or in your community to get your patients to help for mental health are applauded, but often met with difficulty getting patients in because of lack of access, or they're overwhelmed, quite frankly. I know in our region, that's certainly the case. So here are women who need us more, and we can't get them in for help soon enough. So all of us have to rally for best practice answers there. Also, I included this again, just so you remember, COVID is not gone, and we have to pay attention to the good and the bad of what we saw during COVID. And I'll let you look through that again after you finish the session today. Before we move into next pieces, I do want to applaud you all in a very specific way. And for those of you that are trying to decide if you want to be engaged, or like for our breastfeeding expert, where do we fit in and how do we make the process move forward? I am excited to tell you that over 397 nurses, front desk staff, triage folks, providers, primary OB providers, et cetera, have all been trained on post-birth. That is awesome. Over 50, almost 75% of our facilities have now completed post-birth training. Again, that means that now should be happening at the bedside and upon discharge. For Trimester has completely overhauled screening for maternal mental health at 10 delivery sites, with that number climbing by the day. We've improved maternal mental health education at 28 sites. We've standardized the postpartum discharge appointments for 14%. That's a way too low of a number, but we're starting there. I'm happy to report we're at least at 14. And we've teamed up with 11 perinatal community collaborative sites, which links the inpatient setting to the outpatient setting in public health, in a really great dynamic of a circle of care. You all are impacting families and women in Kansas. IRIS communities, I'm going to bypass this. We'll come back to this another day, but it was asked about and talked about in the last few learning forums. They're growing, and we're trying to bring IRIS and referral rates to you all at a higher rate. But for right now, I wanted you to see where IRIS exists as a referral network program. In case you're in one of those counties and want to link up, more information is available. One more thing, and then Kara, you're on cue here. I was, as many of you probably were doing, in March, I was preparing taxes and getting everything together, and I was on the phone with my accountant, and we're talking, and she says, Tara, may I ask you a hard question? And I said, absolutely, you can. And she said, hold on, I need to close the door. So I hear her close the door in her office, and she proceeds to tell me a very, very hard story about an ectopic pregnancy for her, and how she knew that I did this for a living, that she needed to talk about it. It had been several months, and she'd been afraid to say anything to anybody, but that she was still mourning the loss of her baby, felt unheard, had not made her follow-up visit as recommended by her provider, and was floundering. And in that moment of a very professional woman saying to me things that I knew were happening in our state, and to hear a lived experience from a patient who wasn't my patient, but she's our patient, and to think we have so far to go, but appreciated that she reached out. I asked if I could share her story, and she said, I just don't know what to do for myself, but I need to do something. So pay attention to the fact that it could be from somebody in your school district. It could be your banker. It could be all the people. It could be your breastfeeding worker, anybody who's involved with maternal health. I think just the idea that you're a willing participant in a conversation with her. I always go back to this conversation because it keeps happening to me, and I'm sure many of you. Ask her how she's doing, open it up, and get her to the next person in line. And that was in my face this last month, and I wanted to share that with you. I bet each of us has a story just like hers, and we want to help. So how can we help, and where should we help? I have the privilege of introducing. We talk about next steps in our state and where we're going. I invited Kara, who's the new, I'm going to let her be specific about her role because I'm going to mess it up, but the new coordinator for High Five for Mom and Baby in Kansas. We are going to continue the process of breastfeeding, improving outcomes and improving process improvement across the state. And I wanted Kara to come give you a teaser about her coming back to speak to that and later on this summer. Kara?
So much. Well, that was a great start to the meeting. I'm really happy to be here today. I think that we have all maybe worked with families who have had the experience of their breastfeeding experience, whether it's positive or negative, kind of being the beginning of their postpartum journey and how they respond emotionally to that. And so I think that looking at the continuity of care piece here with breastfeeding and postpartum is super important, and I'm really excited for the work that we can do together. For those of you who don't know, I want to tell you just a little bit about High Five for Mom and Baby. High Five was developed back in 2012. Several breastfeeding advocates across the state of Kansas came together and helped form this program, which was supported by the United Methodist Health Ministry Fund, with the goal of increasing the initiation and duration and exclusivity of breastfeeding across the state. So we began with focusing on just 5 steps, 5 of the steps to successful breastfeeding. Thus the name High Five, but we have since expanded to include all 10 steps to successful breastfeeding. And perfect. And there they are. And so I'm sure many of you are familiar with these. Either you're participating in High Five already currently, or maybe in the process of looking at baby friendly, but these 10 steps that High Five is promoting do align with other organizations where you will see those. And so I won't read off all of these to you here, but I do just want to share a little bit more information about the program, so that there are 2 ways that you can be recognized as a High Five participating facility. And the first way is to be achieving 80% or more on any of these 5 steps. So that kind of can be a hang up for some facilities. They'll look at, oh, back a slide, thank you. They'll look at that first step, and for a lot of hospitals, getting that policy in place can be kind of a place where they might be tripped up. And so maybe you don't have your policies all written to support everything, all of the goals that you have for your facility yet. That's okay. You don't have to go in order 1, 2, 3, 4, 5. You could have 2, 6, 8, 9, 10. So any 5 policies or any 5 steps that your facility is achieving at 80% or more can qualify you as a High Five designated facility. And then just recently, we have rolled out our Premier designation, which means that these facilities that are High Five Premier designated are consistently practicing all 10 steps at 80% or greater. Just for our 2022 enrollment, we do have 41 hospitals across the state of Kansas who have enrolled, which is super exciting. And 21 out of those 41 are Premier facilities. So that is an increase of 10 facilities over last year's number. And we have ongoing enrollment. And so just because you didn't get in at the beginning of the year, we are still continuing to reach out to hospitals. And so for those of you who are maybe working with a facility that is not currently a High Five facility, we would love to get you on board and learn more about how we can support you in the work that you are doing, serving breastfeeding families in your community. You can move on to the next slide, please. Perfect. So High Five for Mom and Baby in 2022. This is what we're working on. We are continuing, as I just said, to encourage hospitals to enroll in our program. There's no cost whatsoever to enroll. Reporting on the 10 steps or the 5 steps or however many your facility is currently practicing is completely self-reporting. And so when you go onto our website and fill out the application, the sample size of your audit is really dependent on your facility and what works best for you. So for some of our bigger facilities, a small sample size, looking at their charts or speaking with their nurses can give them a pretty accurate picture of what's going on. And smaller facilities maybe need to audit, a greater percentage of their births. But again, the purpose of that is just to give you an idea of what your facility is currently doing, where you have room for improvement, what you want to work on, and kind of give you that baseline there. So, so that's a little bit more about our enrollment. Also coming up in 2022, we have kickstarted our 10-step Tuesdays. So for those of you who are already on our mailing list, you get a weekly Tuesday tip that relates to one of the 10 steps to successful breastfeeding. We are also continuing to host quarterly webinars. We do have opportunities for scholarships for our enrolled hospitals. So if you need to expand your lactation services in your hospital, and I know that cost can be a barrier for those people who are pursuing their IBCLC certification. So we are happy to provide financial support to employees of your facility so that they can pursue that certification. We're looking for more opportunities really to connect with you and, connect with Fourth Trimester Initiative and other programs that are providing support for our breastfeeding families and childbearing families across Kansas. And then lastly, another thing that we are working on this year that I'm really excited about is increasing our support for policy development, because we are seeing that as kind of a stumbling block for some facilities. So we're working on a policy evaluation tool that will be a free tool for facilities to access to use with sample policies and kind of a checklist format so that they can see where they might find things that they want to add to their policies. So that's a little bit about what we are working on this year. I will be back this summer. So that's very exciting with fourth trimester initiative to do a longer presentation. And again, looking at how we can collaborate and tie in this breastfeeding piece with the postpartum experience and just provide better continuity of care and support for our families here in Kansas. What's next? If you are not on our email list, I do encourage you to reach out. My email address is coordinator@highfivekansas.org. I'd be happy to add you to our distribution list for 10-Step Tuesdays, as well as our other email updates and newsletters, things like that. We do offer free breastfeeding education. This was developed by Gwen Whittet, who was previously in my role. I'm sure many of you know her. If you visit the kansastrain.org website and search for Kansas Breastfeeding Education, there are 15 completely free breastfeeding education modules, and you do get CEUs for those. So that is a great resource to share with your staff if they're looking to increase their breastfeeding education. And hopefully this year we'll be adding LSERPs to those as well. So for those of you who need that education requirement for your license, keep an eye out. And again, if you follow along with my emails, then I'll be making the announcement for when those are in place. Lastly, you can visit our website at highfivekansas.org to get more information on High Five for Mom and Baby. You can also find our online application. I like to say it's quick and easy, but I guess that's a matter of opinion, but it is just 10 basic steps that tie into the steps for successful breastfeeding with drop-down questions regarding your breastfeeding rates. And it's just self-reporting, so we don't require you to submit charts or anything like that. So a quick and easy application will get you linked up with all of the programs that we offer. And you can find additional printable resources and things of that nature on the website as well. So that's that. I know I talked really fast and sped through a lot of information in just a short amount of time, but again, this summer we'll have more time and I will talk slower and hopefully have even more information to share, and do have just a couple of minutes if anyone has questions. Okay, well, thank you so much for having me, and I hope that you could absorb all of that. I tried to just pack in as much as I could, and look forward to working with all of you in the future.
Kara, you did a great job. We talk fast because we have a lot to share, right?
I'm really excited about everything, and I just kept trying to cut things out, and I was like, this is all important. I can't cut it out.
No, and I would venture to guess if I took a poll right now that the majority of folks on this call know about these initiatives. We know that first trimester sites are active in both High Five and baby friendly initiatives. So phenomenal. We appreciate that you joined. I've had a lot of questions about when we get to talk about breastfeeding in this group. And so there it is. They're here. We're all engaged and we're all moving forward. So thank you, Kara, for jumping in today.
Thank you.
Next steps. I have seen 29 facilities, 2 birth centers, 27 hospitals do phenomenal things in the last year and a half. And I've tried really hard to pull in, as we continue to each help each other out, some of the highlights and some of the champions that are really pushing us forward. So I invited 2 today to talk more about how they're using this post-birth training to update policy, how it's really working, boots on the ground, and perhaps some food for thought about things that didn't go well or did go well as they've done this process improvement at their facilities. So first up is Heather. Heather's Director of Women's Life Center at Newman Regional Health. And Heather, I'm so happy you're here. Would you jump in? And then Katie, you're up next. So guys, we have plenty of time, half an hour. So let's let's do your slides. But I think I want to offer some conversation at the end of each, and then collectively, certainly for input and questions from your colleagues. So Heather, take it away.
Okay, well, thank you for having me today. I'm excited to get to present with you guys. So we started our 4th trimester initiative project. We'd actually started with the discharge instructions and just a brief overview with our staff of why it's important back in 2018. Just handing out, we really didn't do a lot of staff education, but we knew it was important for our moms to see the instructions. So if you go to the next slide, first, we started out just handing out the handout from A1 and then having them sign that and then scanning that into the chart. Well, we were finding on chart audits that wasn't always getting done. Anything that's not standardized really, or, every single patient, it tends to fall off. So we worked with our IT department and had, took A1's recommendations on their instructions and had that built into our medical record. And then we wanted it scanned with our mom accounts. Well, in order to do that with the way our hospital set up, we couldn't do that. It would have to go on every patient, which obviously, the tele patients, cardiac, they don't want that on all those other patients. So we found if we put it on our newborn account, then we could standardize it so it would be on every single newborn that's born at our hospital. So that's worked really well. We get 100% of these, so all of our moms get the instructions, and that's just been really helpful. It's one less thing the nurse has to remember to actually print. They don't have to go find a separate handout or anything at time of discharge. So go to the next slide. And then this is just that last page of that. So that's all signed, and then they can see in the medical record. We can just look at the newborn discharge and see that who all has had that. So we could do a quick audit if we needed to. If you go to the next slide. And then we have discharge education books that you can see there on the bottom. We had some funding from different places that helped us purchase these books, which of course I don't want to just advertise for a company, but these books have been amazing. They let us customize the front pocket, the back, and the back pocket. And so we had those post-birth warning signs built into our discharge books, just as a way, that way we know they're not only signing that they're reading it, but if they just flip over that book, they can see those right there when they go home. So that's been amazing for those. Should go to the next slide. And this year, when we ordered new books, I was super excited because the A1 insert is actually in color in the books now. So we did not customize that. That just came into our new packets that we give parents. We get every new mom on discharge. And then we're also giving the magnet that they have for their fridge. So they're seeing it on the back cover. They're seeing it, we're signing it, all the information. So I feel like our moms, we have had a mom say, oh my goodness, I've heard this 5 times, but really I don't think you can hear it too much. What they say, you need to hear things 7 times before you actually retain it. And a new mom, we try not to scare moms. I know we've had that concern also, but I think for the most part, we've had a mom that's came back in for bleeding, and it was almost 6 weeks later. And I really think the nurse that discharged helped her make that decision to come back in. So, and next slide. And just some education, just to make sure we had not added that into our new hire packet. So we've now got the A1 presentation in that, and then we'll be doing that for all of our new staff. We just actually started that with our new staff we have right now. And all of our current staff have completed the webinar. Next slide. And then we're also just working on making sure all of our moms get those follow-up appointments done. So we started tracking that last January. We have a few, some good months, some bad months. One thing we've started doing now, we're going to start actually in April, is most of our fallouts were on weekends. We don't have a way to make those patient appointments during the weekend. So Monday, we're just gonna do all the follow-up phone calls from the weekend, do them first thing Monday morning. And if they haven't made, that way we can just make their appointment for them and call them with that appointment time. So I think that will help increase that. Our OB, we only have basically one OB office, and they say they pretty much get everyone in. But since we've started making the appointments ahead of time, they said it's amazing because they would always, at 6 weeks, they would have all these calls, and they would try to fit everybody in for that 6-week follow-up if they were 6 weeks, and they don't have time by the time they're on that week, it's hard to fit people in. So they said they've just had it's been much easier on the scheduling side. And plus now we know that people are getting into their appointment side also. So I think those have been good things.
Heather, you did a great job. Thank you so much for reviewing that. I do have some follow-up questions specifically. I'm glad you brought up the scaring the moms conversation. So I
Right.
want to come back to that. That's been asked a lot. Are we
Right.
doing too much? So let's come back. Katie, I'm going to have you jump in and follow that up. Introduce yourself. Katie, as the OB manager, and just like many of you, has 15,000 letters behind her name because she really likes her job. So Katie,
Hello,
welcome.
everybody.
Come on in,
Hey,
Katie.
everybody. Yes. Okay. Yes, I'm Katie Kupal. Yes, I'm supposed to say who I am. Here in Onega. I've been the manager here for probably, I think, 27 years now. So a long time, and I really enjoy it. You never get sick of seeing babies and helping new families. It's very rewarding. So when I was telling somebody, the first thing that came to my mind when you wanted me to make a little PowerPoint, I'm thinking, oh, I don't really know how to go about this, and I don't know what I'm really doing. But we had an old CEO, and it was all about if Disney could run your hospital. He had us all read the book. It was kind of interesting, it really was, but it was all about the right people in the right seat on the right bus. And I remember thinking, oh, that's kind of corny. But I think in this situation, that helped us get the right people aboard to really, and they were all very passionate and wanted to help. And that has helped us kind of, roll this out a little bit easier than we would have had it just been OB or, what I mean? It just has helped a lot to have the different people. I think that's been a good thing. So, like I said, we have the director of the clinic, we have IT, we have our chief nursing officer is very involved, patient care manager and the ER manager, which we're about ready to get involved with them a little more. Of course, OB, charge nurse, the night and the day shift, all the OB nurses. We have 2 champion kind of providers that are real big into this, and our social services, and then the lead. We have 7 outlying clinics that take it like a 60-mile radius. So there is a lead nurse that kind of oversees all that. So that has helped a little bit too. So, okay, next slide. I talk too much. Maternal mental health. Well, a lot of that we established during the NAS initiative. And of course, we do the clinics do the opioid and the depression scale. They've kind of increased. I think they're doing it the first trimester, and then the second trimester, and then again in the third. We do it on admission to post or to OB. Like I said, we've done pretty good, and I've audited that, and pretty well most months we're at 100% in OB at auditing that. And then if there's anything that we have different policies, if there's any of them that are like a red flag, then we refer that to, well, we make sure we tell the physician and refer it to social services to get them some kind of referral. All our postpartum moms are screened with the opioid and Edinburgh scale, and then again screened in the follow-up visits. Also, we do chart audits, and that's what I'm saying. I guess I've already said all that. Any scores on the opioid we refer, so that's pretty well that screen, I guess. Next screen. Okay, discharge from hospital. All our postpartum moms are given verbal and written education on newborn care, breastfeeding, postpartum care, and we review the post-birth warning signs. We use the discharge books. I know nobody can see this, but these are the Enjoy books, and they don't have, it doesn't look as nice as the magnets, but it's the same information, and it's called the post-birth warning sign. So I always go over that with the people and tell them to put the magnet. I always say, I'm not trying to scare you. You're young and you're healthy. It's fairly rare, but just in case you ever had these signs, you want to make sure you don't ignore it. So I think, and most of them are like, oh, okay. Also, at the time of discharge, we give them all a date and a follow-up time with everyone. And I think our Amanda Thompson's our IT, she had audited that, and I think we had like 99% of ours are coming back. So it's pretty rare we don't. Part of that's we're a smaller facility, even though we got a lot of outlying clinics, but also our doctors aren't OBGYN, they're primary care. So not only do they see these people for OB, they also do their follow-up care and are their primary care doctor and for the baby. So that, I think that's helped a little bit with this, because they're always checking baby, but mom's there, and they kind of, it's a kind of more of a family, thing. So I don't know if that might be it. Next slide. Oh, rolling out the postpartum. We have a postpartum policy we put together, and our champion providers, they were real enthused with that, and they're kind of starting that in the clinics, and the clinics are all aware of that. And now the next thing, we're going to kind of bring in our ER staff, so they kind of understand that it's important to be asking, have you had a baby in the last year? And I think our EHR, I'm pretty sure it even asked that question. So, but we want to make sure they're all aware that that's important if they're having, hypertension or some kind of bleeding, or to know those facts. So anyway, we're all excited and got a good group on the team, I guess. And I think I've rattled long enough.
Katie, it's an awkward thing when you're on Zoom and you don't get verbal feedback. So you did
It is.
wonderful. I know. As a seasoned manager, I know that you use that as your education. So I feel you, but you did great. Both of you did great. I'm just going to share. Katie shared their policy with you all. And for those of you who will be on site with us in May as a champion, you're going to see this coming from me, that I want you all to bring whatever you have as your current policy. It might be 0, it might be half done, it might be in process, and it might be complete. But we're going to share those tricks of the trade so we don't have to reinvent the wheel. And Katie was kind enough to share that on the front end. Several of you have, but it's really good, really good. Let me stop. Heather and Katie, let's ask these guys some questions. I'm going to start it off. And Heather, can you talk us through the decision, go back to the decision about where to embed the post-birth and the education on the newborn side? That's been, I've heard lots of hospitals not sure where to put it, on the mom postpartum side or on the newborn side. Walk us through why you decided that again.
Really, we just did it from an IT perspective. That was the only way we could tie it to every chart that would make sure we got to every mom. Because if we went to our adult chart, it would go to all patients, like CHF, cardiac, tele, like any patient, ortho. There was no real way to differentiate it. That's the only way we could make sure it printed if we attached it to that newborn.
And Katie, how does yours sit? Does it sit with your newborn side too, or on a postpartum mom side, or where does that go?
You mean that? Now say that again.
Yeah.
You mean
no, the policy. In fact, the one that I'm showing right now. Does that policy exist on the mom side?
No, ours sits in the birthing center, and we have that Power DMS, and it's just in the birthing center, the postpartum policy.
Yeah, gotcha.
This is Mindy. I'm the chief nursing officer too. I was going to add for Katie, it's accessible, but for our clinics, our social workers, and our hospital nurses. So our policy system, they can all see it and use it, and that's kind of how we designed it.
Well, Mindy, since you jumped in, guess what? Hey, what can you tell me your take on a different view? How has this gone in your facility, and what are the gaps that you see happening? Not on Katie. Katie clearly is a powerhouse, but what do we need to do next?
Yeah, Katie's great. I really think it's going. We have 2 very strong provider champions. One of them is one of our new providers, and she loves OB, she loves mom and babe, and so that's really helped. I think Katie and I have been wanting to do, we're already High Five Premier, so that was kind of fun to see High Five on today, and we should within the next month or so be starting an automatic breastfeeding follow-up visit. And part of our education, we feel like even to the providers, is that the breastfeeding follow-up visit isn't as much for the baby as it is for the mom too, for that reassurance that they're doing everything okay, or if they're having problems, that it's getting caught early and not after injuries happened or whatever. So that's been really helpful, and our provider champions have been very instrumental in that. And then we just have a group of nursing, our nurses are very strong in the hospital. They like to learn, they like to do the right thing, and they also cover postpartum care, but they also cover the ER. So it's all the same staff because we are so small. So that's helped as well. So.
Thank you, Mindy. All right, questions from the floor or ideas from those that did not present? Would love to hear you jump on. And Tiffany, I can't see the chat as well in this scenario. So if something's on the chat, I need you to jump in.
Yep, chat is open if you guys want to post your questions there. And there was one question to Newman. Do you just track appointments if appointments are made, or how many moms actually show up to their appointments?
At this time, we're just tracking if appointments are made. We don't, it's actually a separate healthcare system. They're part of Stormont Vale, where they would go for care after. But that's a good thought, way to track it. Just, since we're talking about breastfeeding, we also have it built on our nursery baby. So any baby on discharge instructions, it's also built in when our clinic is, in our free clinic. We do a clinic twice a week on Tuesdays and Thursdays for an hour and a half with our lactation. So it always has the certain times on there, but if they're breastfeeding, we usually try to do a weight check, have them meet with lactation, just do a weight check in 2 days if their doctor say they discharge, and it won't be till Monday if it's over a weekend time. So having that built has also helped, I think, increase attendance at that groups. And it's just an easy way to make sure every patient gets that on their instructions every time. So.
Another question came in. Does anyone have resources in place to assist moms to overcome barriers to attend their appointments, transportation, et cetera?
Katie or Heather, it's not just for you guys, but do you face that question? You do face that question. When you face that question about difficulty, before they're even discharged from the hospital about follow-ups, do you have resources in your community that you call, or how do you work through that?
We do. We've worked with our health department and they've given us vouchers. We've given taxi vouchers just from here at the hospital. We can get taxi vouchers, or we have a bus, I can't think what the LCAT is what we have here in Emporia. And our health department will give them vouchers to get to their appointments if they're needing that help. We ask that, when they're becoming a mom program, and we really don't see too many people that respond, yes, I'm having trouble getting to my appointments. So I don't think we've utilized that really hardly at all, but it is available if people need it.
Do staff, sorry, actually, I think that's awesome that you have that resource. Do staff ask that when they're doing discharge instructions? Do you have any barriers to following up at your appointment? Just because I'm thinking if we could capture in that moment, then we at least could identify whether or not, because I feel like not everyone comes across as being an obvious that they're going to have that barrier. So I feel like there's an opportunity for many missed follow-ups or opportunities there.
I don't think they specifically asked, but I know, we had someone that didn't have a car to get home. And so they did give them a voucher to come back to an appointment because they had to give them a voucher to go home also. So I don't know, we're asking everyone, but I think when they see that need, they're asking, but I've only heard of that once. So that's a good idea though, to add that.
That's really awesome that your health department offers that resource. So that's pretty cool.
Carrie, I will tell you that many of the health departments, I think, are trying to figure out the link from them to you all. And I mean, certainly at Advent Health Shining Mission, but also across the state. And talking to the public health side, they feel like they haven't been able to provide all the resources that they perhaps could help with. And so we're going to work really hard to help you guys connect with folks that may have resources that are identified in patients, generously called the community resource list. But let's pull back and talk about social determinants of health. And standardized screening on social determinants of health, with transportation is clearly one. And so a standard operating screening questionnaire, perhaps done even before admission and labor. But those opportunities for us to have hey, it wasn't obvious or it wasn't figured out, and yet we screened her, she screens positive, let's get her in with transportation needs. So we have some wraparound ideas coming too. If there are other folks on the call that have been using that kind of a screen for transportation specifically, please jump in.
If I could just add one more thing, sorry, we had a conversation with many of our OBs recently at a department meeting where we're having the hot topic of elective inductions and trying to maintain sensitivity to the diverse needs of so many people for those inductions. I am a single parent, I need help with childcare, so we need to do it on this day so I can get someone to come in and take care of my other kids, or my husband's being deployed, so I need to make sure we have it happen by this time, or et cetera, et cetera, et cetera. And excuse me, going on with that, it just makes me realize, gosh, we were fortunate enough to be able to accommodate getting them in for their delivery, that the follow-up appointment is going to be the last thing they're apt to follow, to follow through with. Just if it was that difficult to be able to accommodate the need to come in for delivery, I can't imagine what resources and what extent needs to happen just to help them with those appointments. And I know we've talked about this before, but if I was choosing between my pediatrician follow-ups or my 6-week postpartum with taking time off work or things like that, clearly I would go for my child's needs and bypass mine because I'm fine. I don't need to, follow up. But I feel like there's a lot of moments like that we've heard come across our plate lately. And I feel like they just weren't things that I made the assumption were happening, just to be fully transparent. So food for thought.
Carrie, I appreciate that transparency. I'm going to tell you that that's one of the goals for our general meeting, is that conversation of what were we taught, what have we integrated into all of our practices, and what do we need to look differently at. COVID created that own scenario, but I appreciate you sharing your thoughts. I think nobody's perfect. I want to be clear. Nope, there's no perfect person or practice out there, but I think all of us together saying, I don't think I have it figured out. What are you doing? Is the entire purpose of this initiative. Wonderful work. I also think that the complexity of the family setting, people are still having babies. The birth rate might be down slightly, but still people are having lots of babies. And so, meet them where they're at. And one of the conversations I can't wait for us to have regarding breastfeeding and hypertensive disorder and maternal mental health is, what's the definition of a postpartum visit? Breastfeeding clinic to me is a postpartum visit, a home visitor, a community health worker, a doula. Those are postpartum visits. And so how do we link up everybody to give red flags back to providers if they need to be seen or referred on? That'll be a conversation we continue to have. Other questions for our champions today?
I do have a question. If anyone's had good luck integrating it into their ER, because one of my nurses today is like, I feel like we're sending lots of patients home with all this education, then they're coming back into our ER and they're not really being heard. I don't know. So if anyone has any ways to get ER staff on board to becoming more involved. I know she said that was her next steps earlier, but I don't know if anyone's actually went that far yet and worked with her ER.
We actually start with our new nurse residents, and we integrate their education in with the birth center's education for residency. So the ED staff comes to our pre-eclamptic lectures, our postpartum hemorrhage lectures, and then we share on a checklist with the ED on what to do for our pre-eclamptics that come in through the emergency department. And that was and then we have a monthly collaborative where we meet as a leadership team with our emergency department to kind of talk about any barriers are in place, not just for the inpatient side, but what are you seeing out within the community as well that we can all kind of make an impact with. So I feel like the closer the relationship we can have with our ED, what the irony behind that is, when they built our hospital, we didn't really think about that because we could not be further away from each other. Location wise, but I love the relationship that we formed, and we really do just start at ground zero, and then we carry that through with our OBs sharing with the ED docs information and stuff too, just to kind of keep everyone on the same page.
Awesome, thank you so much.
This is Jessica from Hayes, and we invited our ER nurses to come to some of our post-birth warning sign education sessions and had a few of them come, but not all of them, but hoping that they would like take some of the information back and kind of plant some seeds. And then I plan to attend some of their meetings to kind of fill the gaps for some of their education instead of a full hour dedicated time to the education that we all received, just so that they're all kind of have heightened awareness about moms who come back in.
Jessica, it's good to see your face. I love that you're using train the trainer. That's the affectionate term I use for taking your education and then embedding it in other places, rapid fire, but getting the content across. So that's a great example of how to integrate it in all, even outpatient clinics too, right? Like use the content. We embedded our post-birth training with our EMS and our ER. And it was actually kind of fun to watch everybody in one room, because the only other times that we're all in one room is not a good moment, right? So it's kind of nice to see each other's face relaxed and talk about things. And what a great moment that we're talking about the ER as part of this trend, as part of this initiative. The data proves that that's where sometimes the misses are. And so, if we educate them on the way out and they know that they're going to get a warm door if they have to come back in, that's exactly right. So nice work out there. Nice work. Anybody else before we close the morning out or close the noon hour out here? You guys did a great job today, Heather and Katie, and certainly everybody else that contributed. Thank you. We will continue this at the general meeting on site, but also with our learning forums coming up this summer. One real quick request, and then I'll go back to the general meeting registration just to wrap around and let you go. AIM, remember that's the group that we are enrolled with to do the bundle specific for postpartum transitions. They're doing some internal work to make sure that they've lined up resources accurately and that they've accessed who they need to access. They've asked for a couple of our hospitals that are enrolled, and even some agencies or hospitals that aren't yet enrolled, to reach out, to go through a questionnaire on Zoom with them and to give some feedback in terms of the AIM process and what you know or what you don't know about it. We would love to have a couple of you reach out. Just send me an email that you're interested in that, and I'll pass your information along. But I appreciate your considering of that. And then again, we get to see you guys either virtually for the membership on the 24th of May. Again, I just can't tell you enough. If you guys haven't looked at the registration and read the bios of those that we're going to have, it is going to be life-changing. I've talked to all of them, all 5 of these guest speakers, and I can't wait for that day. So there's a little teaser that you don't want to miss it. Registration is easy. It's online. Make sure you use the right one. If you're a 4-trimester champion, use the one that I sent you. But for everybody else, again, let us know if you didn't receive it. And we will see you all in May. Thank you so much for joining. Appreciate that you took the time. Have a good day. Tiffany, I think we can close it, except for I did not look at the chat at all. So if there's something I need to follow up on, let me know.
I will. I'll send the chat to you. I have another meeting right here at 1, and then I'm going to try to work on the follow-up information, and I'll send that to you. Resource sharing agreement for referrals to the health department for transportation. I don't see any questions that required feedback.
Okay. You know what? I messed up. I didn't ask them to put their names in the chat.
I sent it out again, and I
Okay.
think we captured almost everyone.
Okay.
But we will have the participant list also.
The log. Yep, that's all we need.
Okay.
All right. Thank you
Sounds
so
good.
much.
See ya.
All right, bye-bye.
Bye.